It's Jenny D and Health Tidbits with Dr. Kohli. Of course, you've seen her on 9 News. She comes in and helps talk to us about some things that are trending right now with health and managing your own health. But today we're going to talk about the Apple Watch. It's FDA cleared to detect high blood pressure. So how does this technology work, Dr. Kohli?
It's fascinating. And as a cardiologist, I'm really excited about it because high blood pressure is considered a silent killer.
Mm-hmm.
You know, we've got many Americans that are undiagnosed, and until they start having really severe symptoms and it's damaged the organs, they don't know that they have high blood pressure. So basically what it does is we have sensors on the back of our watch. That's how we detect our heart rate.
Mm-hmm.
If you've ever seen that green light, so it's basically green or red and infrared light that they send into the skin, and then they look to see how it bounces back.
Okay.
And depending on what your blood pressure is, how much volume of blood you have inside those small little blood vessels in your skin, it puts it into an algorithm and tells you whether or not you have high blood pressure. So it's a really cool technology. They developed it in 100,000 people and then validated it in 2,000 more. Now, we don't know if you have darker skin, how well it works. We also don't know if you're somebody who already has high blood pressure, not normal blood pressure. Does it still work to tell us how well your blood pressure is?
Or is it just like a baseline kind of situation?
Yeah, and what it's really kind of good for is saying normal or not normal. It's not good for telling me an exact number. And it's not good for necessarily picking up every person who has high blood pressure.
Yeah.
But the idea here is you're wearing this all the time. It's passively sampling in the background, collects 30 days worth of data. So it's not just a single reading. If you're shouting at somebody who cut you off on I-25 and your blood pressure goes up, it doesn't trigger it.
That's good.
But it's really sort of 30 days worth that it then spits an alarm, consider high blood pressure.
And what should someone do when they get that alarm?
So because this is not a medical device, you want to make sure to validate it with a medical device. So get one of those arm cuffs and record your blood pressure for at least 7 days, maybe even 2 weeks, and talk to your doctor about whether or not it's elevated. So it's more kind of screening people for high blood pressure and putting it on their radar.
And how do they stack up in terms of with like health monitoring accuracy with like their features? You know what I mean? Like, so how accurate do you think that they could possibly get with it?
I've been impressed with the accuracy. Now, I have patients coming into my office all the time. They also have that AFib monitor on your watch, and sometimes they'll come in and their reason for coming in, they'll say, my watch told me I was tachycardic or fast heart rate at rest, or my watch triggered an AFib alarm. So what the watch is really good at is kind of screening normal, not normal, and getting people in the door. Now, every one that it flags is not necessarily going to be AFib. Sometimes you just have a skip here or there.
Yeah.
So it's not very good at making a definitive diagnosis, but it is really good at sort of this population level screening. And what I found in general is that these types of smartwatches, they perform better on kind of fixed tasks. So they perform better on counting steps, for example, or measuring your heart rate, measuring when you go to sleep and when you wake up. They're not very good at getting exact numbers, like your exact oxygen, your exact blood pressure. We still need to do better with validating them for that. But I do like using them.
Yeah.
And I encourage people to start wearing them because they pick up trends, and they're very good at picking up trends.
And there's some misconceptions about the watch, like what they can actually tell you and what it's, I feel like it's an alarm, but what are the misconceptions with that alarm?
Well, so one of the most common misconceptions, if the watch doesn't trigger, then means I'm healthy.
Yeah.
And so you don't want to get, in this false sense of security, thinking that everything is okay when just because your watch doesn't trigger. So that's an important one. The other misconception is that it's a medical device. So people sort of think of it as a medical level accuracy. You never want to rely completely on this. So for example, if you're having symptoms of heart racing and chest pain and you get an EKG on your watch and it says everything's okay, you probably still need to get checked out if you're having symptoms. You don't want to just rely on the watch to make diagnoses or tell you everything's okay or not okay, because it's not really been used in that way. But I'm seeing in medicine, Jenny, we've just moved very much into what's called remote patient monitoring, where we're using these devices, this equipment, to feed data back to us. And if you think about it, it's a better way of assessing your blood pressure, your heart rate, what have you, because you're doing it all the time, as opposed to just for those few minutes when you're sitting in the doctor's office.
Love it. All right. Well,
do you have an Apple Watch?
I'm an Android girl.
No. Well, they have some features.
I was going to say Samsung has some features too, but so it's interesting and also great if you want to check out Dr. Kohli. She's always on 9 News, and she owns the practice Cherry Creek Heart. You can maybe go and check it out if you get a little alarm. Now I kind of wish that I had my watch on. My blood pressure feels good. It feels good right now.
Good.